The National Tuberculosis and Leprosy Control Program, in collaboration with Breakthrough Action Nigeria, organized a training section for media personnel, stressing the media's essential role in championing efforts to eradicate tuberculosis in Nigeria. The Deputy Project Director for Malaria and Tuberculosis at Breakthrough Action Nigeria, Dr. Bolatito Ayinigba, highlighted the importance of media sensitization during an interview with journalists at the 3-day TB training held in Goshen, Nasarawa State. She stressed that raising public awareness through media channels is essential to realizing the vision of a TB-free nation. Let's join Elizabeth Kasham for more.
Dr. Bolatito Ayinigba expressed concern over the limited media sensitization regarding tuberculosis, emphasized the need for increased collaboration between government, partners and media, particularly focusing on children who are highly vulnerable to the disease.
Usually when you find a child that is with TB, the mother would have done a lot in trying to buy cough syrup, using antibiotics and all that, and the child will get better today, go back, like that. So now the communication is that when your child is having fever on and off, when the child is not thriving or is not gaining weight as it should, when the child is coughing and the cough is on and off, you have used cough syrup, it's not going, or the child is not just playing, or that this child, there's something wrong with this child, it should just go to check and be sure that it is not tuberculosis. Because if it is tuberculosis, no matter what you do, that child will not be able to grow well. You can just be suppressing, but that child will not thrive.
Additionally, Executive Director of Media Health and Rights Initiative of Nigeria, Mrs. Alu Eziege, advised the media to be intentional when reporting on social health issues, particularly on marginalized communities, saying it is important to ensure their specific challenges are highlighted while reporting.
For instance, we learned a lot about the DHTB and the multi-drug resistant tuberculosis. If you are talking about tuberculosis generally, and you don't zero in on the multi-drug resistant tuberculosis people, they might not understand and they may not learn the lessons well. If they go to apply what they've learned from you, it may boomerang. It may not help them and it may make their cases worse. So it's very important to zero in on marginalized people, to understand what their issues are, so that you're able to meet their needs during production and during reporting.
IT and Communication Officer at Ntblcp, Steve Raji, acknowledged a significant knowledge gap concerning tuberculosis, especially on social media platforms. He said the government has been intensifying efforts to increase TB case finding by employing social and behavioral change strategy with the aim to raise awareness, correct misinformation, and encourage proactive health-seeking behavior among citizens.
So we have just about 25% of the population that have correct information on tuberculosis. A lot of people still have myths about TB. So what we try to do is to ensure that we give out this right information about TB, the basic signs and symptoms, the preventive measures we can take. Because TB is preventable, it is treatable and it is curable. Not a lot of people know this. And we also ensure that people are aware that testing for TB is free. 100% free in Nigeria. Treatment is also 100% free in Nigeria.
The training focused on building capacity in human-centered reporting and other skills necessary to enhance program ratings, including a commitment to regular reporting on tuberculosis, increased participation in TB programs, and active community engagement to further contribute efforts to broader goal of eradicating tuberculosis in Nigeria. Elizabeth Kasham, ASO Television News.